Good morning, everybody. This is Ellie Miller, Program Manager with Minnesota Housing for the Bridges Rental Assistance Program. I'm joined today by Gary Travis from the Minnesota Department of Human Services. Gary, do you want to introduce yourself briefly?
Sure. Good morning, everyone. This is Gary Travis. I work with the Department of Human Services Behavioral Health Division and am a happy partner on the Bridges program.
We are going to review today the Bridges Rental Assistance Program request for proposals. And attendees are still joining the line, but we're going to go ahead and get started. As people know, on the line, DHS and Minnesota Housing work collaboratively to manage the Bridges and Bridges RTC programs. Today's presentation is about 30 minutes long. In the remaining, the very tail end of the session will be used to gather your questions. And we'll talk a little bit in a couple of slides about how you can enter your questions, and we'll make sure that we answer them. We're going to try to keep the question and answer session specific to the things that are in the presentation today, but we will also post an FAQ on the website if there are questions outside of this presentation today that you need answered. Minnesota Housing provides access to safe, decent, and affordable housing and builds stronger communities across the state. Minnesota Housing offers products and services to help Minnesotans buy and fix up their homes and to stabilize neighborhoods, communities, and families. It also supports the development and preservation of affordable rental housing through both financing and long-term asset management. It has pioneered a successful model for supportive housing that helps stabilize the lives of some of the state's most vulnerable citizens. As I said, here's the agenda for the day. We'll talk a little bit about Bridges and Bridges Regional Treatment Center program, the application, how to submit the application, and then at the very tail end, we will provide plenty of time to answer any questions that you might have. Next slide. So if you're not familiar with the format that we're using today, GoToWebinar. I know a lot of us have used a lot of formats over the last year. This one is not one I've used for a little while, so I'm going to review sort of the toolbar in the right-hand corner. It allows you to ask questions using the question feature, which is showing on my screen right now in the orange box. At any time during the webinar, you can type questions and click the send button. The questions you send will land in a queue and we'll respond today, as I said, either directly in this format or in an FAQ document. Just so you know, today's presentation will be recorded. So any questions also that are answered today in the format will be hosted on our website through this presentation. In the red rectangle is a hand raising feature. When you click the hand icon, it's as if you're raising a hand in an in-person audience. We can then call on you verbally and unmute your phone line. If you've used the audio pin, we're able to do that if you've called in through phone. You also have two options for listening to the presentation. You can listen through your computer, or you can listen using a telephone. There's a dial-in number and an access code, and again, an audio pin. If you are planning on speaking in this presentation or asking questions, you want to make sure that that audio pin is entered. Next slide. So let's start with the Bridges and Bridges RTC overview. Next slide. Here's an overview of the program for those of you that are on that aren't familiar. Minnesota Housing currently provides funding statewide to housing agencies, tribal nations, and community-based nonprofit organizations that administer the Bridges program. The funds are administered through the RFP, which is what we're preparing for. For this round, we're going to be releasing just under 10 million in grants from two sources, so 9,700,000. The available funding is obviously contingent on the legislature and also receiving money from the Department of Human Services, which is our second source. And as always, the Bridges grants through this RFP do not provide the funds for the supportive housing services. Next slide. So eligible applicants are housing agencies, tribal nations, nonprofit organizations with demonstrated experience managing state and federal rental assistance programs or other low-income housing programs. New applicants with experience working with populations that Bridges is meant to serve are encouraged to apply. Grantees that are currently subcontracting with agencies to serve the region are encouraged to discuss the current contract with their local mental health entity and decide if people would be better served if the subgrantee had their own grants within the service area. Next slide. In order to be eligible, the applicant must also include a partnership with a local mental health entity. There's a new requirement that we're going to be talking quite a bit today, where not only is the applicant going to be in partnership with a local mental health entity, there will be a focus in the Cooperative Agreement, which is something that the entities will sign in entering into contract for Bridges, that will highlight in a little bit more detail the relationships with the behavioral health service partners in the area, and also the agencies that are providing housing stabilization services in the area. And we'll get into that more when we talk a little bit about cooperative agreements. But the applicants not only need to partner with that local mental health entity, but we're asking for a little bit more detail about how the program will be administered in the area. Next slide. So a local mental health entity can be a mental health authority operating under the authority of the county, a tribal nation mental health agency operating under the authority of a tribal government, or a mental health initiative, which is a collaboration of county LMHAs and the tribal nation mental health agency. Next slide. So we're going to get into who Bridges and Bridges RTC serves, and you may want to pay a little bit extra attention to the eligible participants. As we get into this, some of the definitions have changed. The first is the definition of mental illness. The last contract round, we changed this definition to just show as mental illness as it's defined in statute, where prior it was listed as serious mental illness. And Gary, do you want to talk a little bit about that change in definition and what that means from a service perspective?
Sure, I'm happy to. Well, functionally, there's a fairly limited change in that Minnesota doesn't have an official definition of serious mental illness, and within the Comprehensive Adult Mental Health Act, we use mental illness as our primary definition for the Bridges program, with the understanding, to quote from the definition, this is a mental illness that seriously limits a person's capacity to function in primary aspects of daily living, such as personal relations, living arrangements, work, and recreation. The definition of mental illness, or serious mental illness, as it's frequently called, includes fully individuals with a serious and persistent mental illness, which is a far narrower bar for people to access resources. I really want to highlight that the target here is for people with mental illness. The goal, one of the kind of goals of Bridges, is to be very low barrier access, and individuals with SPMI, if that was our primary criteria, would be a very narrow bar for people to access the resource. And I think, Ellie, I will hand it back to you.
Okay, that covers it. The participants need to be eligible for a housing choice voucher, and we've really emphasized that the and/or another permanent housing option. We want to be able to expand at least the eligibility for people entering into Bridges that during the lifetime of being on the Bridges program, that they can become eligible either for a housing choice voucher or a permanent option that makes sense for that participant. And again, we can talk more about the details of that as you get into contracts after funding. The eligibility for income is still at or below 50% of the area median income. Next slide. The priority populations have expanded, and this is an area to pay attention to. The priority populations for Bridges, the first priority is still given to people living in an institution or segregated setting, but the definition has expanded to include correctional facilities and people who are under correctional supervision who will be homeless upon exit. There'll be more detail as to how this shifts the program a bit, but paying close attention to the priority is still people living in institutions, but the definition has expanded. The second is people experiencing homelessness who are assessed as high priority homeless. Previously, this was listed as long-term homeless or eligible for permanent supportive housing. This is just lining up with the current coordinated entry system and their definition of high priority homeless. This may involve a little bit of conversation with your coordinated entry systems, but again, this is a second tier, with the first priority being people living in institutions. And then the third category is still people who are experiencing homelessness or at imminent risk of homelessness.
Ellie, I would just briefly add that the priorities, like you're saying, should be identified as, top bullet being the first priority and working down to the second and third priorities from there. I would also like to really reinforce the need to clearly identify the service partnership and resources that will be provided to effectively serve people coming from these priorities. We need to have a clear understanding of how Bridges as a subsidy resource and the service resource will be working together. Thank you.
Next slide. Under the Bridges Regional Treatment Center program, an eligible participant is defined as a person with mental illness who is eligible for Bridges and who is referred from these institutions and who will have significant and complex housing barriers. Gary, do you want to talk a little bit about the services that address the significant barriers?
Yes, I would really, again, reinforce the need to be clear about the service linkages that are occurring, in particular for this group of individuals who frequently have very high or complex barriers to accessing housing. The goal of Bridges RTC is to help people move directly from the RTC or limited or treatment that they may be in into housing. So that will take a very concerted effort to ensure that the resources are in place, whether that be behavioral health services or housing stabilization services of some sort, or even other grant-based resources such as the Whatever It Takes program that could be useful in supporting these transitions. Ellie?
Great. Next slide. Gary, do you want to talk a bit about the referral sources for RTC?
Sure. The Bridges RTC referral sources should be making sure that they have in place a strong connection between the Bridges provider and the RTC that might be involved, whether that's AMRTC or the Forensic Services and Community Hospitalization. Also working with county and tribal partners who may be facilitating service access and or monitoring individuals that are going through these treatment programs. Be very clear in how these referrals are made, that the referrals are made early in an individual's treatment so that housing opportunities can be explored as soon as possible with the individual. And let's see, I think I will hand it back to you, Ellie.
Okay.
Remainder of the slide.
So the eligible uses for both Bridges and Bridges RTC is the next segment, and this is also changed. In order to accommodate the expansion of the definitions of the priority populations, we have also expanded the eligible uses of the rental assistance dollars. And this has been something that the providers have been asking for through the contract term. But now you may make direct payments to the landlord for the subsidy portion, which has always been the case. But you can also do direct payments for security deposits to include double damage deposits or additional security deposits. Application fees, we can include more than one application fee and application fees for search for housing. The vacancy payments and damage claims have been expanded. Before it was just a payment for a psychiatric leave, and we have expanded the definitions for those two payments and claims. We're also open to payments for utility companies and connection fees as it relates to getting people into housing, and open to other direct payments as approved by Minnesota Housing. So we're hoping that this expansion should help providers and community in assisting people who might have barriers to housing in what is a very tight housing market. Next slide. One of the other changes is in administration fee limits. At the time of selection, Minnesota Housing approves a monthly administration fee, and it's described in your Bridges and Bridges RTC grant contract agreement. At the time of selection, we approve, given a range of approved fees, and it's based on the target number of households, the amount of the grant, the geography of the service area, the population served, and other relevant criteria. So what we've done for this round, if you are a current grantee, you will be applying with your current amount with an adjustment that's been given for inflation. And if you're a new applicant, you must propose your administrative fee with this inflationary number included using the guide. So the Bridges program guide can be found at minnesotahousing.gov. And it'll give you the specific steps, the criteria to sort of determine what your administration fee should be. Next slide. So the new fee limits were adjusted for inflation, and as it breaks down, it's approximately $8 per household per month. So the fees, the range is from $53 per household per month to $68 per household per month. And there's an example there of it's approximately $8 per household. So for existing providers that are applying again, you will be using this new range, and the amount that you were awarded for your administration fee before, you will adjust to accommodate this range. Next slide. So the program expectations, we talked a little bit about the partnership and the cooperative agreement. We'll talk a little bit more about the cooperative agreement again later. So this is just another overview of a little bit of the change. But the expectation is that Bridges grantees are participating in the local mental health entity meetings at least twice a year and have the collaborative working relationships with that entity. Each activity that is listed in your cooperative agreement is either the responsibility of the grantee, the local mental health entity, and we're expanding that out to say that there also may be some responsibilities included in the agreement with your local behavioral health service partners and the new agencies that are providing housing stabilization services in the area. The cooperative agreement is a document that holds all of this information, and typically we require the cooperative agreement to be churned in with due diligence before contracts are signed. And this year, we're going to be holding off on requiring that cooperative agreement to be finalized until after the contracts are in place. And we're going to be providing a lot more assistance and understanding how to use this as a working document in the area to make sure that all of the services, the resources that are identified are really well laid out and what should be a working document for the area. Gary, do you want to add anything to that?
Yes, I would really like to reinforce the intention behind the cooperative agreement is to be that active document that really clearly lays out the expectations and duties of all the parties involved. Agencies and bridges programs that struggle are often struggling around a misunderstanding or lack of follow through with the cooperative agreement and the partnerships that it's meant to support. I would also highlight that this cooperative agreement is really a tool for helping to reinforce the housing mission statement of the Comprehensive Adult Mental Health Act and assure that individuals are getting access to the housing resources that they need. So have that discussion with your partners about your roles, the expectations for effectively meeting those roles, and how you can best represent that within the cooperative agreement.
Great.
Thank you.
Next slide. This is just saying some of the same things. And again, there'll be a lot of assistance in the due diligence training, which is coming up in April, prior to the end of this contract period, for you to better understand the program expectations. Next slide. Bridges RTC also has a cooperative agreement for the contract term, and essentially it's an endorsement from the local mental health entity, and again, including behavioral health service providers in that cooperative agreement. Next slide. The focus on diversity and inclusion has been sort of on the forefront with the current administration. Bridges and Bridges RTC programs are intended to serve people with mental illness, so including that population is the obvious. But it's also intended to serve the most underserved populations and vulnerable households in the service area. Agencies that have the capacity to utilize what we call foundational service practices tend to be a best fit for Bridges and Bridges RTC, as they're really able to create access for people with mental illness that have barriers to housing. For those of you that aren't as familiar with the foundational service practices, those are listed not only in the Bridges area of the website, but also on the information sheet if you need to get familiar with the things that have been proven to create access for this population. We are requiring that providers collect and report data on their progress in reaching underserved populations and providing service to the most vulnerable households in the service area. Next slide. That's it for the overview. We're going to get into some of the more details of the application now. Next slide. So the goals of the application and scoring methodology are to incentivize grantees to be high-performing agencies that strive to serve Bridges participants in the best way possible and that track their outcomes to continue to improve program practices. Similar application, this is a similar application as we did the last contract round, with just some emphasis on some of the key changes that we've made to the program. Gary, do you want to talk a little bit about the RTC focus for the priority population?
Yes, the intention behind the Bridges RTC program is really to serve the needs of individuals who are moving through Anoka Regional Treatment Center or through the RTC and program in the St. Peter area, to assure that these individuals with the very high barriers have access and opportunity to access housing and Again, you should really identify the population, how you're going to meet the needs of this particular group, and strategies for addressing that. Thank you.
Great, next slide. So the way that the application is scored, there's a total possible score of 100 points for Bridges applicants and 105 for RTC applicants. Because new applicants will not have a score for prior performance, they're asked to provide answers to 4 additional questions in the application. The answers will be used to determine a performance score for the new applicant. The following tables that you'll see in the next slides highlight the points for each application category as well as for performance. The application has 5 sections for all applicants, and each section will be reviewed in today's presentation. Applicants applying for RTC will have an additional section, as do new applicants. Existing grantees have a performance section that they will be scored on, which is something that the program management team completes at Minnesota Housing. Next slide. So the first area is for priority population with a maximum score of 15. And the criteria that you see listed on your screen are the scoring criteria if the applicant is demonstrating a maximum score. So the way that the language reads would indicate that the full 15 points was achieved. There are categories for the reviewers where the applicant may be moderately achieving this goal or not meeting this goal at all. But what you're seeing is if you're fully achieving the area. So for priority populations, as we said, the priority population has expanded to include correctional facilities and people on supervised release. It's going to be important for scoring well in this section to identify ways of meeting that priority population expansion. Next slide. The program design and implementation, again, has a maximum score of 15. And applicants must have the ability to serve the region named in the application and have the resources available to move participants to permanent subsidies. Those are the 2 major program design areas. I emphasize again in this section, in order to do that, strong partnerships with new agencies or agencies in your area providing housing stabilization services is going to be key for scoring well in this area, as they are going to be important for locating housing in this tight market. Programs also that monitor utilization and have administrators that prioritize permanent subsidies for Bridges participants will also tend to have positive outcomes in this area. Next slide. Diversity and inclusion. Again, Bridges intends to serve people with mental illness. Applicants should also be serving diverse populations and creating strategies to reach underserved populations and groups that are disparately impacted by homelessness. One of the areas that is expanded a little bit, if you don't have a tribal nation with tribal land in your service area, we're asking that you look for ways to do outreach to Indigenous people that may be living in the region. A lot of providers have posed questions about how to access Indigenous people if it's not through the tribes or through tribal land. And if you have questions about how to reach that population of people, we have tribal liaisons that work for Minnesota Housing and the Department of Human Services. We're able to help with that question going forward. But to score well in this area, some strategies to do outreach to that group should be included. Next slide. The foundational service practices, again, are practices that create access to people with barriers to housing and to people with mental illness. To score well for this section, a minimum score of 10, there should be strategies that your agency has employed to make sure that access is created for populations. And the services are included here as well with a 15-point score. Finding partnerships creating effective strategies, identifying resources. These are the things we're talking about that are outlined in your cooperative agreement, demonstrating a strong plan that the region has met. They've come up with a good resource and a good plan, identified specific ways that this population is going to be served and housed and remain stable in housing. Next slide. The scoring methodology section for RTC, the applicants must complete the applicant areas to receive a total of 105 points. Again, those are additional questions just for people seeking the RTC only part of the grant. For current grantees, again, you must complete the current grantee section. If you are applying for RTC and regular Bridges funding, there is something called the budget form, and there will be two forms. I'll talk a little bit about that will need to be included. So some of you will be applying for both pots of money, and there are some specific requirements in the checklist for you folks that are doing both. So new applicants, if there are any on the line, you'll be evaluated based on your capacity to administer the Bridges program, relationships with landlords and behavioral health service agencies in your area, having strong referral process to receive applicants, and then also having staff with experience working with people with mental illness and have policies in place to create access for people with mental illness. After the grant review committee has met and the scores have been finalized, the state agency staff may incorporate the scores into final funding recommendations that may also be based on geographic distribution, services to special populations, and the applicant's history as a state grantee and capacity to perform the work. Final funding amounts will be dependent on the amount requested, the number of applicants, and the amount available to distribute. Applicants with score below 50 points may not be funded, or they may be given conditional funding and be required to receive technical assistance. Decisions are at Minnesota Housing's sole discretion. Additionally, Minnesota Housing reserves the right to request proposal revisions during the due diligence phase of the contract period, which is after Minnesota Housing board approval, but before the grant contract agreement is executed. Next slide. So the Bridges budget form, I won't be pulling up the budget form today, but I will say that all of the details to complete that budget form are in the instructions tab. And as I highlighted, if you're applying for both the RTC funds and the standard Bridges funds, a budget form needs to be completed for each of those. It's in the utilization tab is an important part to highlight for both programs. Next slide. The application checklist includes the application signature page, the budget form, submitted again, Bridges and Bridges RTC of both funding, the local payment standards, the current financial information, and the affirmative action certificate form. Next slide. The financial documentation, all non-governmental organizations applying for $25,000 or more must supply the following current financial documentation depending upon their total gross revenue. Next slide. The affirmative action certification, if your response to this solicitation is or could be in excess of 100,000, you need to complete the affirmative action certification form and provide the documentation of compliance if necessary. Next slide. If you are selected for funding, you will be required to submit due diligence items. In prior bienniums, there was some leeway on the execution date of agreements, meaning that they could be executed after July 1 and still be retroactive to July 1. This is no longer allowable. All required due diligence items must be submitted to Minnesota Housing by Monday, June 7th, 2021 for us to execute an agreement by July 1. If due diligence items are late, we'll have to execute your grant contract agreement at the time that we receive the items, which means your contract may not be retroactive. Any payments made after July 1, 2021 without a signed contract cannot be reimbursed. Next slide. The cooperative agreement we've talked quite a bit about, and we are going to be receiving these after the due diligence phase. And in April, there is a due diligence training to get into more of the details. The remainder of these items are required at the time of due diligence phase. So the waiting list selection plan, the SWIFT vendor number and W-9, the electronic funds transfer authorization form. Next slide. This is a timeline of events for the RFP. This is listed also in the RFP instructions. I think the biggest to note is that it's a fairly tight turnaround of the application being due March 19th by 12 p.m. noon. Minnesota housing staff will make recommendations to the board Thursday, April 22nd. And then those selected would receive notification by April 26th. As mentioned previously, there'll be some work to do after the contract period around the contract agreements, specifically the cooperative agreement. So that is not listed on here, but the due diligence training is listed, and that's when you'll receive the additional details on that. All required due diligence items must be submitted to us no later than Monday, June 7th, again, to execute the agreement by July 1. Next slide. So the submission, next slide, again, is March 19th. Submit the original format to the secure upload, which is the instructions can be found on our website, but there's the link as it shows to our website. Next slide. And the threshold criteria in order to be considered. I can't emphasize enough the importance of submitting the right documents with the right information on time. On the day that we receive applications, our staff must ensure the application meets threshold. This happens before we review application materials in their entirety and before we hand off applications to the reviewers to score. Everyone should highlight these bullets because if you do not complete one of these tasks, your application could be rejected before it's even reviewed. So timely submission and making sure that the budget form is included, that the narrative is complete, that the application is signed, and all checklist items are complete and submitted on time. Next slide. Remember that you can ask questions today using your questions box or your chat feature, and we can respond to those questions now if you have them. Any questions that come in between now and the time the application is due, we will type up and post as an FAQ on our website. So you may want to, as you're completing your application, check in with our website periodically for the frequently asked questions, because we will have responses posted there. Next slide. And I am not seeing any questions coming in. Christy is our organizer. Are you getting any questions in your question feature? Okay, it looks like we've got some questions coming in. I'm not seeing any questions yet in my question box. Here, I'm just starting to get one. The question is, where does segregated settings fit in? Gary, do you want to talk a little bit about segregated settings from your perspective?
Certainly, I'm trying to clarify, would like to clarify the question a little bit. Segregated settings tie back to the original priority list. I don't know if you have that slide available to share.
Sure, I can pull up which slide that is, the priority populations.
Right.
Would be slide 11, Christy.
So segregated settings covers a broader range of potential settings than strictly institutional settings, but segregated settings may include adult foster care. It may include a whole range of potential settings that essentially are limiting the person's access and participation in the local community in some way. May include institutional settings, hospitals, intensive residential treatment centers.
I think we have a full list of segregated settings included in the information sheet for the RFP, and there may be a section in the Bridges guide as well that really does a good job of listing segregated settings.
Right. Their segregated settings have more features that are segregated rather than a particular type of setting. It can really vary. And I would, again, direct you to the guide for additional information.
Great. Second question is, if we are a current subgrantee and we are looking at submitting on our own instead this round, second. How should we fill out the application as a new user or existing, since we have data on current? I would recommend reaching out to me directly, and there's my email. Really would depend a little bit about the subgrantee situation that you have specifically, and then what data that you're referring to. But I'd be happy to help you as an individual in figuring out the best way to apply. We have a state prison in our jurisdiction. We currently work with the local parole officers. With this new change, do we have to work with this new change? Do we have to work with the state prison? So you currently work with the local parole officers. I guess the question is, would you need to switch the referral entities to the prison instead of the parole officers? And I think, you know, we're going to have the individual service areas make decisions on the best way to create access to the program for the region. And you know best and how to create that access. And if it's through the current relationship with the parole officers, then you want to really explain that out in your application. Gary, do you have anything to add to that?
I guess I would just clarify that this is really serving individuals under correctional supervision, and that could be kind of any particular correctional status. And you should look at the whole range of potential partners and referral sources that you have available. So I see no reason to exclude one referral source over another. That's it.
But there wouldn't be necessarily any requirement in your application to create referral sources unless you as a region have strategized and considered that as the best way to move forward. So there's a clarification for a waiting list for priority. The first priority group does not involve coordinated entry, correct? This is our waiting list system we create and design ourselves. Applications signed, are electronic signatures acceptable? Okay, so I think the first part of the question is yes, the priority population does not include coordinated entry. That would be the second priority group. And I will have to check in on the status of electronic signatures for the application. I know that we have moved to electronic signatures for contracts, but I'm not aware of that signature page. So look on the FAQ for the response to the electronic signatures piece. Next question is Hqs Inspections. Sorry, it keeps, when she adds a question, it jumps down to the bottom. So I apologize for scrolling back up. The application asks about how this will be done remotely. Currently, Bridges providers must do initial inspections and are permitted to suspend annual inspections. If a Bridges provider wants to continue with only in-person inspections, is that okay? Are they required to come up with systems for remote Hqs inspections? So that's one of the highlights, the new highlights in the guide, and there is information in the application about virtual inspections and how you plan to integrate that. The guidance on virtual inspections will be coming out with a new release of the guide, which is going to board tomorrow and should be up on our website by next week, which will give you a nice definition of what is allowable for virtual inspections. And there isn't a requirement to do the virtual inspections. And in some cases, there are some exemptions or some ways that the Hqs inspection will not be allowable. So before I answer that question, I'll ask you to go to the website next week, look at the updated information on virtual inspections in the guide, and it's up to you as a provider to make a decision on how you integrate that guidance and come up with a plan to make sure that you are inspecting units across your region. There also is COVID guidance right now around inspections, which is kind of wrapped into this question about postponing the annual inspections until after the COVID period of guidance, and look for guidance separate from this RFP and how to move forward with annual inspections. There should be guidance coming out soon related to that.
Ellie, it looks like there was a bit of clarification on the local parole officers question.
Okay.
And that was meant to be county parole officers. I think I would just further clarify that, again, this is looking at corrections as a broad category, that partnership should really engage with your correction systems based on what's available locally and who your potential partners are. That may be state corrections, that may be county corrections, that may be tribal corrections. There could be a lot of different ways to approach assuring serving people in this priority.
Okay. Next question is, explain the able to go on to Section 8. At the time their name comes for Section 8 review, an item occurs where they don't qualify. Can they remain on Bridges and reapply for Section 8 the next time it would be available? And the answer is yes. The Bridges is designed to remain people stably housed until they receive that permanent option. So if at time they become eligible for one permanent option and they haven't resolved barriers that would make them eligible, they are eligible to remain on the Bridges program and continue to resolve those barriers to housing. And again, being open to what might be other permanent housing paths that individual might be eligible for, if not the housing choice voucher. Gary, this is for you. Would a sober house be considered segregated?
Again, that's going to depend on the particular model of sober housing, but generally I think that it would meet the criteria. Again, I'm going to refer you to the guidebook and the criteria listed there. And if there's a specific example, I would suggest submitting that to Ellie so that we could review it for the fact.
Next question is under correctional supervision referring to people who are in halfway housing or on parole, or is it only for people who are to be directly released from jail? The idea of including people under correctional supervision is not to give specific time limits to the release date. And some of the reentry programs that are working with populations exiting correctional facilities, there has been a very specific time that they must have been released. And it can be at any point underneath their correctional supervision, as long as they were released into correctional supervision with no housing option and are still in need of, they're still, not stably housed and in need of housing. So it's a definition. There may be some individuals that go into halfway housing that are still precariously housed. It's not, not a permanent or the right housing for that individual to become stable in housing. It's a temporary situation where they're not receiving the level of service that they may need. Those people under correctional supervision would still be eligible. The idea is that if they're under correctional supervision and in need of housing, that they would be eligible to enter the program. Gary, do you have anything to add to that?
No, I think you covered it. It's meant to be an inclusive population, not exclusive, I think, would be one way of thinking of it.
Okay. Okay, so another question about, just want to make sure that we're using the right admin fee. $8 per household per month is the increase. And it looks like we may have had a typo or something in the percentage, 18%. So if you're currently receiving $45 a month per household per month, you would add $8 to that amount per household for your new admin fee that you would enter. If you're receiving 60, you would add 8, etc. Let's see, when I referred to local parole officers, I meant, okay, that was the one you clarified, Gary. So again, just clarification, the submission will not include a proposed cooperative agreement. That is true. The waiting list policy was included in the checklist. And then again, we will reach out for the due diligence training to address the cooperative agreement more specifically at that time. So the waitlist policy, I can confirm in an FAQ. I'm fairly certain that is on the checklist. But the cooperative agreement is taken off the checklist for the due diligence phase, and we will address that in the due diligence training. Next question is, do you need a separate agreement with all referral sources? It's not a requirement to have an additional agreement with your referring agencies. I think in the cooperative agreement, as we stated, it should mean be a working document for the area. And I think if you're going to identify everybody's specific role in the area, one of the most important, roles, at least initially, is who are the referring partners for the priority populations. And if it makes sense for your area to really spell that out, either in the cooperative agreement or in another agreement, I think that makes sense to be really clear on who's providing that, but it isn't something we're going to ask for as a separate agreement as part of this application process. Okay.
I think it's useful to be very clear about where your referral sources are, who your referral sources are, how you are assuring choice of service, and really effectively assisting people with accessing the service resources that they want and need.
Next question, where do we find more info on the expansion of eligible uses, process, etc.? Will this be addressed in the program guide? Could it be used to pay off old debts to landlords in order to remove a barrier to find housing? That's a great question. The new guide is going to board tomorrow. Again, it'll be on our website next week, and all existing providers, I'll make sure to send out an email with a link and where to find that new guide. And again, we may send out something in the FAQ just indicating that the guide is there. But yes, all the eligible uses are better defined in that guide. And as far as old debts to landlords, that might qualify underneath additional payments as approved by Minnesota Housing. Next question, the application asks for data on number of households initially enrolled but unable to find housing. Should we include people who were issued a voucher but fell out of contract with us, stopped returning our calls, letters, etc.? We don't know if they found housing one way or not. Yeah, I think I would include, those would be people who you initially enrolled and didn't find housing. I would include that in your number. I know it may elevate the number, but we're not looking at it as a punitive measure. It's just more of a turn-away number that we can use legislatively more than anything. Okay. Is there a more expansive specific definition of correctional supervision? Again, in the information sheet, I think there was a definition of correctional supervision, but I'll have to double check that and we'll include it on the FAQ if not. It may be in the guide. There's so many documents right now that we've just recreated that I'll have to double check. So if you're looking for a more expansive definition of correctional supervision, look on the website in the next FAQ. And again, just to double back, anybody that has been released that's on supervision, correctional supervision, it's meant to be inclusive if they're still in need of housing. Can you make a requirement to be on bridges for a period of time before being able to move on to another program? That's more of a programmatic question and not necessarily specific to this RFP. If it's an existing provider, if you want to reach out to me directly about your program requirements, I'd be happy to answer that for you.
Ellie, I think I would just want to try and clarify with this one a little bit. Is this an expectation that an individual is required to be on Bridges? Bridges is a voluntary program for both subsidy and services. The other program may have stable housing expectations built into it. that again, I think they could follow up with you, Ellie, like you were saying.
Okay. Yep. To clarify, we must have multiple partners that will assist in submitting this application, multiple agencies such as corrections, mental health, and others. Yep, the clarification is that in your cooperative agreement, you still are partnering in signature on that cooperative agreement with your local mental health entity, but that is still the partnership. What we're asking for is that that partnership dig a little bit deeper in including in their cooperative agreement the other partners that are essential in making this program work successfully. So the behavioral health entities in the area, the corrections entities that will be referral sources to get at the priority population, other resources in the area, other agencies that have resources that serve this population that have dedicated their time and attention to making sure that this population gets service. That's what we're asking. That's the level of detail. But the partnership and the signature that comes in that cooperative agreement hasn't changed. It's still between the local mental health entity and the housing agency. Will MHFA be removing the serious mental health word from the MH verification form? We are finding that professionals are hesitant and not willing to sign due to the wording on that verification form. Gary, do you want to talk a little bit about that?
I think that's a reasonable request, and we can certainly look at updating the verification form. The intention here is to really assure that, again, Bridges is being targeted for individuals with the highest needs and barriers, which is why serious mental health is frequently used. Additionally, the SMI designation really aligns with other housing resources, whether that's through the continuums of care or other sources where SMI is identified as a qualifying criteria.
Thank you for that question. We'll take a look at that outside of the RFP and look at it as a barrier to housing, and Gary and I can work on addressing that. Is there a minimum time a person needs to be in jail to qualify for Bridges? And there isn't a limit to the time that they're in a correctional facility as long as they are released to homelessness and attached to correctional supervision and entering the program. And again, you know, I think we're talking about people with significant barriers, addressing the needs of, you know, vulnerable people in the area, but there isn't a qualifier related to time in jail. The next one is for new admin fee, we could ask for additional beyond the 53. We have additional expenses. So the clarifier, if you're an existing provider, is you have an existing admin fee amount. And the instructions are that you can increase that for inflation by adding $8 per household per month for this submission. If you're a new applicant, you follow the guidelines in the Bridges Guide to determine what your base entrance admin fee is. If you have additional expenses that exceed that amount, that's understandable, but that is the amount that has been approved by a board for us to give to providers as it relates to this contract. Will a utility allowance for Bridges be considered in the future? Yes, we've gone around and around on utility allowances, and I understand the barrier that it presents. Again, this is not an RFP question, but just to say that we have considered it in the calculation. I know it affects the housing choice voucher placement, but it is not included in the changes to the guide in this round or for the purposes of this Okay, so another one on the wait list policy. Again, I'm going to check on that as a due diligence item. I did have the contracts manager review the list before this was submitted, but I'll have to double check with them. So check back with the FAQ on whether the wait list policy will be a required due diligence item. Thank you for double back and confirming that. The Bridges waitlist selection plan must be submitted with the application stated that it must be reviewed and approved by Minnesota Housing. With the new priority populations, how will it be reviewed and approved prior to this application submittal? So waitlist, okay, so just giving more detail, again, I'll have to check with the contracts manager. My assumption is that if we do need to review and approve it, and it's going to be a new plan for the provider, that it would need to be submitted during the due diligence phase. But let me circle back with the contracts manager and again, post in the FAQ the exact directions with the waitlist selection plan. Thank you for being thorough and checking in on that. Providers that are on the line, I appreciate it. We'll make sure to get you clear direction on that. That's it for the questions on my end. Are there any anything else? Any new questions that I'm missing?
I'm not seeing any.
Okay. Well, thank you. That was a great list of questions. Those questions really help, I think, all providers in planning for this application. So thank you for attending this information session and for providing us with feedback and for getting good questions out for everybody to better understand what we're asking for. If there are additional questions, again, you can send those to me. My email is up on the screen. That's the best way to get a hold of me right now. Pose the question or any information that you need to have a successful application submitted. And again, if I receive a question by email at any phase during this application process, we will repost FAQs as we're receiving those questions. So check our website for updated information on a regular as you're completing this application process. Thanks again, everybody, for attending, and we look forward to talking with everybody soon. Enjoy the rest of your day.
Thank you. Goodbye.
Thank you, Christy and Gary, if you're still there.